Here is a comprehensive overview of metoprolol, a commonly prescribed beta blocker. Shat 1. General information. Generic name, metoprolol. Drug class, beta blocker, beta-1 selective adrenergic receptor blocker. Dosage forms, oral tablet, immediate release, 25 milligrams, 50 milligrams, 100 milligrams. Oral tablet, extended release, ER, 25 milligrams, 200 milligrams. Injectable solution, 1 milligrams milliliter. Brand names, immediate release, Lopressor, extended release, Toprol XL. Definition. Metoprolol is a cardioselective beta blocker that reduces the workload on the heart by slowing the heart rate and decreasing blood pressure. It is used to treat several cardiovascular conditions. Mechanism of action. Metoprolol selectively blocks BEAT1 adrenergic receptors in the heart, leading to decreased heart rate, negative chronotropic effect, reduced myocardial contractility, negative inotropic effect, lowered cardiac output and blood pressure, reduced oxygen demand of the myocardium. It does not significantly affect BT2 receptors at therapeutic doses. For indications, hypertension, angina pectoris, heart failure, ER form only, myocardial infarction MI, acute and maintenance therapy, atrial fibrillation flutter, rate control, migraine prophylaxis, off-label, hyperthyroidism, adjunct. Hatter 5. Contraindications. Hypersensitivity to metoprolol or other beta blockers, sinus bradycardia, second or third degree AV block without pacemaker, cardiogenic shock, overt cardiac failure, severe peripheral arterial circulatory disorders. Hyper 6. Before taking this medicine, precautions. Tell your healthcare provider if you have asthma or COPD, may worsen bronchospasm, diabetes, may mask hypoglycemia symptoms, thyroid disorders, kidney or liver impairment, history of depression, circulation problems, e.g. Raynaud's disease. How to use. Take with or immediately after a meal to enhance absorption. Take the medication at the same time each day. Swallow extended release tablets whole. Do not crush or chew. Follow your doctor's dosing instructions carefully. Dosing information. Typical adult doses. IR, 100 to 450 milligrams per day in divided doses. ER, 25 to 100 milligrams once daily, max 400 milligrams per day. Angina, I 100 to 400 milligrams per day in 2 doses. ER, 100 milligrams once daily, may increase gradually. Heart failure, or only starting at 12.5 to 25 milligrams once daily. Target dose, 200 ill infarction. Initial IV, 5 milligrams every 2 to 5 min, 3 doses. Then oral IR, 25 to 50 milligrams every 6 hours. Maintenance, 100 milligrams twice daily. 9. Missed dose, overdose. Missed dose, take as soon as remembered unless it's close to the next dose. Do not double up. Overdose symptoms, bradycardia, severe hypotension, bronchospasm, cardiac arrest, seizures. Treatment, supportive care, IV fluids, atropine, glucagon, vasopressors as needed. 10. When to stop or avoid taking. Do not stop suddenly without medical advice, may cause rebound angina or MI. Avoid if experiencing severe bradycardia or hypotension, acute decompensated heart failure, severe allergic reactions requiring epinephrine, may reduce epinephrine efficacy. 11. Side effects in detail. Common side effects: fatigue, dizziness, bradycardia, hypotension, depression, cold extremities. Less common: shortness of breath, GI upset, nausea, vomiting, diarrhea, rash, sexual dysfunction. Serious side effects: heart block, severe hypotension, bronchospasm, especially in asthma, COPD, worsening heart failure, hypoglycemia, and masking symptoms, allergic reactions, rash, swelling, anaphylaxis. 12. Vital information. Monitor blood pressure, heart rate, ECG IV, signs of worsening heart failure. Beta blockers may mask symptoms of hypoglycemic tachycardia. Caution in diabetics. Gradual tapering is essential when discontinuing therapy. 13. Drug interactions. Metoprolol may interact with calcium channel blockers, e.g. verapamil, diltiazem, increased risk of bradycardia AV block, antiarrhythmics, e.g. amiodarone, additive cardiac effects. CYP2D6 inhibitors, e.g. fluoxetine, paroxetine, may increase metoprolol levels. Clonidine, rebound hypertension risk if withdrawn concurrently. NSAIDs, may reduce antihypertensive effect. Insulin or oral antidiabetics, enhanced hypoglycemia risk or masking of symptoms. Digoxin, increased risk of bradycardia. Thank you. Have a nice day.